Good morning, everyone. Bonjour à tous. Je suis très heureux ce matin d'être en compagnie de la vice-première ministre Freeland et du ministre Champagne. A year ago, there was so much to learn about this new virus, and the pandemic was about to be declared. But right from the start, one thing was clear: that Canadians would step up to whatever challenges lay ahead. Well, every day since, we've seen that to be true. From the experts running testing centers and doing world-class modeling, to the manufacturers making masks and gloves, Canadian know-how has kept people safe. It has saved lives, and it has helped us chart the path through this crisis. That is something worth investing in. Chaque fois que les chercheurs en comprennent plus sur un virus comme la COVID-19, qu'ils développent des meilleurs traitements contre le cancer ou améliorent la propreté de l'air, ils contribuent à sauver des vies. La science fait aussi en sorte que nos enfants héritent d'une planète plus saine. La recherche est importante. Elle améliore nos vies chaque jour. Et c'est exactement pourquoi on doit continuer de la soutenir. Today, we're taking another historic step forward for Canadian innovation. With $518 million through the Canada Foundation for Innovation, we're investing in groundbreaking research. This funding will support over 100 projects and hundreds of researchers, whether in studying viruses like COVID-19 or developing cancer treatments and fighting climate change. Just take the research into digital healthcare that will be possible because of today's investment. With this funding, doctors at Women's College Hospital in Toronto will be able to develop a cutting-edge virtual care lab. This will move us forward on getting everyone the health care they need, even if they can't leave their home. And after the year we've had, I think it's clear why that matters. Bien entendu, quand on parle d'innovation en ce moment, on pense tout de suite aux vaccins. Dans le cadre de notre investissement sans précédent de 518 millions de dollars destinés à la recherche canadienne par le biais de la Fondation canadienne pour l'innovation, on stimule les efforts visant à fabriquer des vaccins au Canada. Par l'entremise du Fonds d'innovation, une équipe de chercheurs de CHU de Québec et de l'Université Laval travaille sur des moyens de continuer d'accélérer l'élaboration et l'essai de vaccins ici même au pays. Ce financement va appuyer ces travaux et ceux d'autres personnes à travers le pays. Canadian innovation is one of our best tools to beat this pandemic. That's why we've made historic investments in science and research to fight COVID-19. That's why, since 2015, we've funded domestic vaccine research, development, and manufacturing. And it's why we turned the page on the previous government's approach by instead fully supporting and standing with the science and researchers who keep us healthy and safe. Au cours des 5 dernières années, on a fait des investissements sans précédent dans la science et la recherche. Cette pandémie nous a rappelé pourquoi c'est si important de le faire. Et elle nous rappelle pourquoi il ne faut jamais retourner à l'approche du gouvernement précédent qui consistait à réduire le financement destiné aux sciences. Et la pandémie nous rappelle aussi qu'on a encore du travail à faire. Un investissement dans l'innovation, c'est un investissement pour vous et votre famille. C'est un investissement pour aujourd'hui, pour demain et pour les années à venir. Les Canadiens ont le savoir-faire et la créativité nécessaires pour relever tous les défis et on sera toujours là pour appuyer ces démarches. Que ce soit pour les vaccins ou pour les soins virtuels, votre santé est notre première priorité. Et à ce sujet, je vais vous donner une mise à jour sur les livraisons de vaccins. This week, Canada hit a big milestone: 2 million vaccines administered across the country. A true Team Canada effort. We've been working every single day to reach our targets, and everyone who wants to will be vaccinated by the end of September. Maybe your grandparent, your parent, your family member or friend has already got their shot or has got an appointment to do it soon. Well, we all want to feel that relief. So to everyone, know that your vaccine is on the way. Very early this morning, our first 500,000 doses of the AstraZeneca Oxford vaccine from the Serum Institute arrived in Canada. Already, the National Operations Centre has worked with provinces and territories to coordinate shipments of these vaccines across the country. Our priority is getting doses into arms as quickly as possible, because we've got a lot more vaccines on the way. Grâce à Moderna, Pfizer et AstraZeneca, on va recevoir un total de plus de 1,8 million de doses au cours de cette semaine et de la semaine prochaine. Concrètement, ces chiffres, ça veut dire que des gens que vous connaissez pourront se faire vacciner bientôt. Des parents, des grands-parents, des travailleurs de première ligne. C'est la lueur que vous attendiez. Merci aux gens qui attendent patiemment pour que leurs parents et grands-parents puissent se faire vacciner en premier. Aux gens qui ont un rendez-vous pour se faire vacciner, je sais que vous allez continuer d'être prudents par après pour vous protéger et protéger les autres quand même. Just last June, I met Luc. He's the owner of Régimbal Awards and Promotions, a family business here in Ottawa. The first wave of the pandemic hit their business hard, but with the wage subsidy and rent support, they were able to rehire staff and keep their doors open. Well, 8 months later, and Luc's store is still going strong. In fact, they're even continuing to give back to the local fight against COVID-19 with their Stronger Together campaign. Through this great initiative, they're donating proceeds from their fabric face masks, tees, and hoodies to the Ottawa Community Foundation for the most vulnerable in the city. Across the country, there are so many stories like Luc's. To date, the wage subsidy has supported more than 5 million people, and the rent subsidy has been there for over 129,000 businesses and organizations. We've come a long way in the fight against this pandemic, but we're not out of the woods yet. So for Luc and for people across the country, I have some important news to share. We are extending the Canada Emergency Wage Subsidy and the Canada Emergency Rent Subsidy and Lockdown Support at their current levels until June. In other words, we're making sure that the wage and rent subsidies continue through the spring and that the amount of support remains consistent. This isn't the time to pull back on support for workers or business owners. It's the time to see people through what is hopefully the final stretch of this crisis. And it's the time to get the whole economy ready to come roaring back. So that's exactly what we're going to do. On prolonge jusqu'en juin la subvention salariale d'urgence du Canada, la subvention d'urgence du Canada pour le loyer commercial et l'indemnité de confinement. Les montants ne changeront pas. Si vous êtes un travailleur ou un propriétaire d'entreprise, vous allez avoir la certitude et le soutien dont vous avez besoin pour traverser le printemps et vous remettre sur pied. Les temps sont durs, mais on est là pour vous fournir le soutien dont vous avez besoin pour surmonter cette crise aussi longtemps qu'elle durera. Le printemps s'en vient, les vaccinations sont en cours et de meilleurs jours nous attendent. Merci beaucoup. Je passe maintenant la parole à la ministre Freeland. Christia.
Okay, well, thank you, Prime Minister, and it's good to be here with everyone. Hello. Today, we're announcing that the government will extend the current rate structures for the Canada Emergency Wage Subsidy, the Canada Emergency Rent Subsidy, and lockdown support from March 14 to June 5, 2021. This means the maximum wage subsidy rate for active employees will remain at 75%. The maximum rent subsidy rate will remain at 65%, and lockdown support will remain at 25%, providing hard-hit businesses with rent support of up to 90%. Je tiens à être clair quant aux raisons pour lesquelles nous prolongeons les taux de la subvention salariale, de la subvention pour le loyer et de la mesure de soutien en cas de confinement. Nous le faisons car, à cause de la pandémie de COVID-19, l'économie canadienne a fait face à son pire choc ponctuel depuis qu'on tient des registres à cet égard. Selon les chiffres publiés par Statistique Canada hier, il y a eu une contraction économique de 5,4%. Même si nous avons vu des signes encourageants de reprise, y compris une croissance plus élevée que prévu dans le quatrième trimestre
Fourth quarter of 2020, we are not yet at the end of it. Today, there are 800,000 plus fewer Canadians working than at the beginning of the pandemic. We continue to live with COVID-19.
the virus. Vaccines are rolling out in ever greater quantities. This is good. There is light at the end of the tunnel. But we cannot definitively say that we've turned the corner. That means that public health lockdowns and the supports that sustain them must continue to be available to Canadians where and when they are needed. Now, I'm going to tackle this next point head on. I've been surprised to read some commentary suggesting that Canadians may be doing too well for their own good. Some have pointed to rising household disposable incomes in the first 9 months of last year as evidence that our government acted too swiftly and too effectively to support Canadians. I disagree. As former Bank of Canada Governor Stephen Poloz has pointed out, a firefighter has never been criticized for using too much water. I think we must now add this caveat, unless it's by a conservative pundit in Canada. Now, let me be very clear. When COVID-19 struck, our government needed to step up quickly, decisively, to prevent Canadian families and Canadian businesses from falling off an economic cliff. And our government will continue to do whatever it takes for as long as it takes to help Canadians through this bleak time, to prevent economic scarring, and to invest in a way that allows us all to come roaring back after COVID-19. Canadians can count on us. Of course, we are constantly, carefully evaluating government spending, government debt, jobs numbers, and economic growth. We are prudent and we are responsible. But sometimes the greatest danger is not to act. And we understand that risk too. Our government is by no means alone in taking this approach. On the contrary, we are in the vanguard of a global response to this global crisis. The International Monetary Fund, in a recent report, explicitly lauded Canada's actions. Our response, the IMF said, and I quote, provided crucial support to the economy and the functioning of financial markets and helped protect lives and livelihoods. The IMF also warned Canada, and I quote, to avoid a premature withdrawal of policy support. Nous faisons exactement.
We are doing exactly what we need to do in this unprecedented time, and that is to support Canadians. We will continue to do this work, this important work, and I will now give the floor to François Philippe. François Philippe, please. Thank you, dear Krista, for giving me the floor. Good morning, everyone. The pandemic has demonstrated the importance of scientific research in order to find solutions to real problems.
Labs right here at home lead to a healthier, greener, and more prosperous world, as the Prime Minister said. That's why today's announcement of more than $500 million to support Canadian research through the Canada Foundation for Innovation is so important to all Canadians. Ce financement viendra en aide.
This funding will help over 1,000 researchers and contribute to more than 100 projects across the country, be it for top cutting-edge lab equipment or creating crucial research databases. This investment will help our researchers across the country in concrete ways.
Other cancer treatments or developing clean technologies. Our Canadian researchers need these kinds of tools to turn their bold ideas into reality. This is both about leadership and excellence. And the way to bridge that gap is precisely to adequate funding. Our government is pleased to be contributing again to that effort. The benefits of investing in research infrastructure are countless. It creates spaces to train the next generation of STEM professionals, brings together scientists and entrepreneurs who can jumpstart innovation, and it helps Canada remain at the forefront of scientific discoveries. It is well known that we are a government that believes in science. Since 2016, we've invested over $10 billion in science, research, and the people who power it. We are proud to support our researchers by founding state-of-the-art facilities in which they can work to solve today's most pressing problems. Now more than ever, Canadians are looking to our scientists and our researchers to come up with innovative solutions to the challenges we face. Mes plus sincères félicitations.
My warmest congratulations to those who got the funding announced today. We will ensure that we meet the challenges and contribute to the health and safety of Canadians. Thank you to everybody. Prime Minister, you have the floor.
Thank you, Minister Champagne. The Prime Minister and ministers will be taking questions for 20 minutes. One question, one follow-up, starting with the phone. Merci beaucoup, Monsieur le Ministre Champagne. Le Premier ministre et les ministres prendront des questions pour 20 minutes. Une question, une sous-question, en commençant par le téléphone aujourd'hui. Opérateur, c'est à vous.
Thank you. Merci. Première question, Lina Dib, La Presse canadienne. À vous.
Lina, La Presse canadienne. My question follows on Ms. Freeland and then you, Mr. Trudeau, either one. The extension of these programs to June had been announced, but the rates are going down. It's less and less generous. Can you tell us how much it will change in terms of what you had budgeted? How much more money are we talking about for businesses than announced? Since the beginning, we had said, Lena, that we would be here for people as long as it took with all the supports necessary, and that's exactly what we are doing. We know that, yes, we are getting to the end of this phase of the pandemic. That's a good thing. At the same time, we have to ensure that we can ensure a strong recovery, and that's why I'm pleased to turn the floor to Krista to complete the answer. Thank you, Prime Minister. Thank you, Lena. As I indicated, our approach is very cautious. We had already anticipated in the forecast that it might be necessary to do what we had announced today. So it had already been set out in all the figures that we had published in November. To be specific, we estimate that to March 13th, the cost of the rent program will be approximately $4.4 billion. And from March 14th to June 5th, the additional cost will be $2.1 billion. With regard to the wage subsidy, we estimate that the cost to March 13th will be approximately $83.53 billion. And from March 14th to June 5th, the additional cost will be approximately $13.9 billion. And I would add, only if these are programs where it will depend, in fact, on the situation that Canadian businesses face. The level of assistance will depend on business revenues. So we will spend less if the economy is stronger, and we will spend more if the economy is weaker and if businesses need further assistance. Thank you very much, Lena.
Merci. En suivi, Lina?
A follow-up? Yes. Obviously, the federal budget is approaching. The opposition parties are asking for some things, and we're hearing a more and more political and partisan rhetoric, particularly with regard to the economy. Mr. Trudeau, I'd like to hear a response to Mr. O'Toole, who said yesterday that you were trying to rethink the economy, and it wasn't time to do that at all. Rather, it was time to help keep all jobs in all the sectors instead of picking winners and losers. Mr. Trudeau, thank you. First, I think it's important to understand that there are huge differences in approaches by the different parties and how we should help the economy recover and prepare for the future. And this is an extremely important debate. And I hope that all Canadians will be involved in this over the coming months and the coming year, because this idea of rebuilding better, building back better, is something that affects us all. We cannot deny that the pandemic has changed our behaviors, has affected the way that we see ourselves in a year or in a decade. It is our duty to take this opportunity and the responsibility that we have through this pandemic to better prepare ourselves for the future. Investing in science, for example, we recognize that people who were already vulnerable before the pandemic are all the more so as a result of this pandemic. So we have made choices as a government to help the more vulnerable members of our society, to offer more assistance to those who really need it. It's not just a moral argument. It's about creating a stronger economy for the future. These are values that underlie everything we try to do as a government, not because we have a moral approach, but because we understand that a strong economy depends on the participation of all. As Mr. O'Toole said, and as Conservative politicians are saying, he thinks that we acted too quickly. We were too generous in helping Canadians. But our understanding is that by helping people now, we are ensuring better growth for everyone in the coming months and the coming years. The Conservatives do not agree with this approach. It is up to them to make that argument. But as I indicated, the promise that I made from the very beginning was that we would be here for people as long as it took, with all the amounts needed, because it was the right thing to do for people and for the Canadian economy.
Thank you, Prime Minister. Operator, next question on the phone.
Thank you. Merci. Next question, Ryan Tamilty, National Post. Line open.
Yeah, good morning, sir. President Biden yesterday said that he expects his country will have enough vaccine to inoculate all its citizens by the end of May. You said that you expect that milestone to be reached here by September. Do you worry about the American economy potentially being able to open much sooner than the Canadian economy and the impact that'll have on businesses here?
Obviously, we are working extremely hard every single day to get as many doses to Canadians as possible, as quickly as possible. And as I've been saying since past November, We expect all Canadians to be vaccinated by the end of September for those who want it. We are seeing, however, an increase in the number of vaccines coming into Canada as we had hoped for. It's possible that those timelines be moved forward, and we're certainly going to work closely with the provinces in order to try and get to that, to get vaccinations to Canadians as quickly as possible so that we can loosen and reopen as quickly as possible. Obviously, the pandemic has had a very different course in the United States with far greater death tolls and case counts. And that has had its own impact on the American economy that Canadians haven't quite felt the same way. So it's always something we have to be careful about in comparing each other. But certainly, we're going to continue to work to get as many Canadians vaccinated as quickly as possible by following the science and following the best recommendations of our experts.
I think that obviously people know that we are working extremely hard in order to deliver the most number of vaccines as quickly as possible so that we can get through this pandemic as quickly as possible. We have made the promise in November that everyone would be able to get vaccinated if they so wish by the end of September in Canada. Obviously, we are optimistic that perhaps we'll be able to move those up based on the number of vaccines that we're approving and having delivered in Canada. And we will continue to work in order to accelerate this process, working with the provinces and respecting and listening to the best advice from our scientists. In fact, when it comes to some measures, the U.S. are ahead of us, but we also know that the United States had a much more serious pandemic than we did, with more deaths, more cases per capita than we did here in Canada. So we always have to be careful when we compare the experiences in different countries. But it is this government's priority to ensure that we get the most number of vaccines here possible quickly as possible.
Yeah, sir, I totally understand what you're saying about the disparate death tolls between the U.S. and Canada. Obviously, they've had a much worse pandemic, but that won't change the fact that by summer, their businesses will be able to reopen, their tourism sector will be able to come back to life. That could have a dramatic economic difference between where Canada and the U.S. is. Is there anything you can do beyond just trying to secure more vaccines to help alleviate that difference?
We are working very, very hard to get more vaccines more quickly, and we're seeing the results of that work with the delivery this morning of 500,000 doses of the AstraZeneca vaccine from the Serum Institute. That wasn't part of the calculations we had when we promised to Canadians that we'd have 6 million doses by the end of March. So now we're going to have well more than 6 million doses by the end of March. That is good news. And with the progress made on the approval of the Johnson & Johnson vaccine, with Novavax vaccines coming, with more doses of many vaccine makers coming forward in time, we're very optimistic that we're going to be able to accelerate some of these timelines. So we're going to continue to do everything we can to allow our population to get through this challenge as quickly as possible so we can get to rebuilding and moving forward as rapidly as we possibly can. That is our focus. Nous savons.
We know that we all want to get through this as quickly as possible, and we are going to work with the provinces and territories, with the partners, vaccine companies, with experts, in order to do this as quickly as possible and as safely as possible. At the same time, we had good news today with 500,000 doses that we hadn't anticipated getting, that we will get from the Serum Institute, AstraZeneca. We know that what we had already promised, that is 6 million doses by the end of March, will be exceeded by several hundreds of thousands of doses as a result. And in the spring, we will have tens of millions of vaccine doses delivered in Canada. We have hope, therefore, that we will be able to accelerate the reopening process. But at every stage, We are going to first and foremost ensure that we follow public health criteria. If we open too quickly, we could have worse consequences for the Canadian economy than waiting a little bit longer to ensure that it's safer, it's better. We have to ensure this balance, and that's what we will do.
Merci. Opérateur, dernière question téléphone avant de passer dans la salle.
Final question.
Next question, Justin Ling, freelance. Line open.
Good morning, Prime Minister. Obviously, in 2019, your government instituted changes to how federal inmates are placed in isolation. You claimed that you were putting an end to solitary confinement in keeping with several court rulings calling it unconstitutional. A new report from last month concluded that that didn't happen, that fully a quarter of all federal inmates going into these cells were still being held under the definition of solitary confinement, and fully 10% met the definition of torture. Given that, are you going to implement any changes to comply with those court rulings and to follow your own law on the matter?
Obviously, there remains more to do, Justin. We've taken very seriously this report, making a commitment to end solitary confinement, administrative segregation is extremely important to this government, and we will move forward on that. We have made significant progress, but as that report and as your work has pointed out, there is more to do, and we will do more.
Following up.
So the data, your own government's data shows that you're torturing fully hundreds of federal inmates. Is there going to be accountability for that? Is someone going to resign or be fired or lose their job? Is there going to be any immediate action taken to rectify this?
We've taken very seriously the report put forward, and I can assure you that Corrections Canada and Minister Blair are following up on this. It is unacceptable that we still have Canadians in such difficult circumstances. We need to make sure we are respecting their rights and respecting our commitments to end administrative segregation, and that's what we're going to continue to work on.
Merci. On va maintenant passer pour les questions dans la salle.
Hi, it's Annie Bergeron-Oliver from CTV National News. Sort of following up on what Ryan was just saying, you know, President Biden yesterday did move up his timeline to the end of April. Your timeline and target is still 5 months behind the Americans. And why is it that Canada is so far behind the US? And why are you so hesitant to move up our timelines, despite the fact that you keep telling Canadians we're expecting tens of millions of doses coming in the spring and summer?
Every step of the way, we've seen that these are new vaccines with new manufacturing processes, with new approval processes. And as we move forward, we've had to listen to and respect the best experts and the best science around how to keep Canadians safe. We know that getting more vaccines into more Canadians more quickly is the goal we have. We need to make sure we're doing it safely. And the projections we've had for many, many months certainly hold, but we're also very optimistic that they're going to be able to be moved forward if, indeed, all the vaccines that we've contracted for are able to be manufactured and shipped in the right ways. We will continue to work every single day to bring in more doses for more Canadians, to get through this as rapidly as possible. And we are encouraged by seeing positive results around the world that bode well for what Canada is going to be going through the coming months.
Are you concerned then that some of these vaccine shipments won't arrive, and that's why you're not moving up the timeline?
I think we've seen from the very beginning disruptions around upgrading of the Pfizer plant in Belgium has demonstrated that there were little delays for a few weeks in getting as many as we'd like, although we are now fully back on track and even ahead of schedule in terms of where we were hoping to be for the end of March. We've seen challenges around supply chains with Moderna that had to get worked through. These are new processes for new vaccines that are being manufactured in the millions and even in billions in order to cover all of everyone on Earth. These will be facing continued challenges, which is one of the reasons why we made such a deliberate effort to sign more deals with more different companies than many of our fellow countries, in order to be able to assure that regardless of disruptions or challenges or some vaccines not working out at all, we would be able to get Canadians vaccinated as quickly as possible. And that is what we continue to be focused on. Nous savions depuis le début.
We knew from the beginning that it would be new vaccines with new processes. That is why we made the choice as a government to negotiate more contracts with different companies, more different companies than most other countries, in order to ensure that we could get more doses per Canadian than in any other country in the world. As a result, we are confident that if there are delays or if there are vaccines that don't work at all, that we will still be able to vaccinate Canadians quickly and get through this pandemic. We will obviously continue to accelerate the processes and get more vaccines. This is because we know that this is how we will get through this pandemic as quickly as possible.
Hi, Prime Minister Tom Parry with CBC. BC and other provinces are now talking about putting a 4-month window between the first and second doses of these vaccines. I'm wondering if that changes your timeline in any way. Do you see a scenario where most, if not all, Canadians might be vaccinated, say, by summer? And just on the U.S. Timeline, if the United States does reach its goal, do you see them loosening up their grip on their own supply, maybe allowing some vaccines to flow to Canada once they've got enough vaccines for their own population?
Those are excellent questions, Tom. It's something we're monitoring very, very closely. The federal government job has, from the beginning, been to get as many vaccines that are safe and effective to Canadians as possible. And we signed the contracts, we're paying for the vaccines, we're bringing them in, and then we're working with obviously public health experts, the National Advisory Council on Immunization, working with provinces and chief medical officers across the country in order to deliver those vaccines to Canadians in the most rapid and most effective way to keep people safe, to get through this pandemic quickly. Obviously, we're seeing some of the science shift, some proposals put forward, which are very, very interesting, which could result in rapider timelines, but every step of the way we're going to be informed by the experts, by science, by the recommendations on the best way to protect Canadians, particularly vulnerable Canadians, and the best way to get through this as quickly as possible. It's possible those timelines move forward, but we're going to base those decisions on the science.
The U.S., though, do you see the U.S. opening up?
In my conversations with President Biden, it was very clear that they understand that, like us, we know that you don't get through this pandemic anywhere, not fully, until you get through it everywhere. So like most countries around the world, they are prioritizing their own populations, but they are also, by stepping up on the COVAX facility internationally, by looking at how they can be helpful around the world, very open to helping out other countries, and those conversations will continue.
When I spoke with the president about vaccinations and our responsibility to end this virus, not just here, but everywhere in the world, he understood that need, demonstrated that he understood the need to invest in COVAX and vaccines for the rest of the world. We will work together, obviously. The priority for every country remains to vaccinate their own population, but we also have work to do together to get through this, and we will continue these conversations.
Monsieur Trudeau, j'aimerais...
Mr. Trudeau, I'd like to hear you talk about the issue, the fact that you are optimistic that we might be able to move the September deadline forward. Could it be possible that all Canadians by the beginning of the summer might be vaccinated if they so wish? And the provinces, do they have the capacity and logistics now in order to be able to ensure this effort can happen as quickly as possible? Answer. With regard to the scenario, it's not up to the politicians to say the best way that vaccines can be used. Rather, it's the experts, the scientists who will do so, the public health experts in the provinces and the territories who are making the decisions as to whom will be vaccinated and what the timeline will be between the doses. And there are new recommendations that will have a positive impact on the experience of Canadians in the coming months. But I cannot speak to what the experts could say or could conclude, except to say that we are working very, very hard in order to get through this as quickly as possible. And the second part of your question was? Inaudible for the interpreter. Well, with regard to the timeline, it will depend greatly on the decisions that are made by those experts and by the provinces about vaccinations. Also, we know that we are coming to a time when we are moving from limited resources in terms of the number of vaccine doses available to having tens of millions of doses coming into the country in the coming months. The challenge then of vaccinating the most people possible as quickly as possible will be one of logistics, and I'm very pleased with the conversations that we continue to have with the provinces and the territories, as well as with family doctors associations, pharmacists, and private businesses that regularly deliver to their own employees flu shots against the seasonal flu, for example, and perhaps could also provide COVID vaccines to their employees. There are all kinds of different approaches that we're looking at. We are doing this to ensure that it will not be logistics that will hold us back in terms of our capacity to deliver all the doses coming into the country and to do that as quickly as possible.
Good afternoon, Mr. Trudeau. This is Man Hamidi with the Canadian Press. Amnesty International Canada and others are calling on you to intervene with France and put an end to the persecution of Ottawa sociologist Hassan Diab, saying he is a clearly innocent and mere scapegoat in a decade-old bombing. Now, given your June 2018 comment when you said that what had happened to him, to Mr. Diab, should never have happened to him and should never happen again, will you or one of your ministers intervene with the French authorities regarding this?
We have continued to engage with officials in France on this case, and we will continue to. It has been a priority for us to make sure that we're standing up for our citizens all around the world with countries that are challenging, but also with our allies, and those conversations will continue.
Minister Michael Couture with Global National. This morning, China's ambassador to Canada told Canadian reporters that allegations of genocide of the Uyghurs are, quote, the lies of the century. What do you make of that?
We have and will continue to take very seriously the very credible reports of human rights abuses in Xinjiang, in China, perpetrated against the Uyghurs by the Chinese state. There are significant concerns being expressed all around the world, and the Parliament of Canada was very clear about its concerns just a few weeks ago. We have committed to work with our allies internationally on both getting clear answers and holding to account those responsible with possible consequences that the world can bring forward. But this is something that is much better done on a multilateral basis. Over the past many years, including a couple of occasions directly to Chinese leadership, we have expressed our deep concern for the situation facing the Uyghurs, and we will continue to do that alongside our allies to make sure that we are actually having an impact on what's happening to that community. Ça fait plusieurs années.
We have been deeply concerned for a number of years about the situation of the Uyghurs in Xinjiang. We are very concerned by reported abuses of human rights abuses by the Chinese government against that community. We have directly raised this issue with Chinese leadership. We are working with our partners and allies across the world in order to get better answers as to what is happening, but also to coordinate our efforts and the consequences for a state that continues to be responsible for serious human rights violations. We recognize that the Canadian Parliament and others have recognized what is called a genocide, and we will work with our allies around the world to advance this case of protecting this minority and ensure a change in behavior.
Up in that same news conference, reporters asked the ambassador whether or not the case of Meng Wanzhou and the two Michaels are connected, and he said, quote, there's no connection between the cases, they're totally different. Do you agree with that?
No, it is obvious that the two Michaels were arrested on trumped-up national security charges days after we fulfilled our extradition treaty responsibilities towards our ally, the United States. Chinese officials at the time were very clear that they absolutely were connected as a frame. And nothing the ambassador can say now will dissuade me from understanding that that is indeed the case. C'est très clair.
It's very clear that the two Michaels were arrested on trumped-up national security charges immediately, a few days, that is, after we fulfilled our extradition responsibilities to the United States. Chinese authorities have admitted that obviously they were connected, and anything that the ambassador is now trying to say will not convince me otherwise.
Qui met fin à la conférence de presse d'aujourd'hui.
Merci tout le monde. Merci Christian. Merci François-Philippe.
Merci.